You know that feeling after a strenuous workout when you're grasping for air? That is a feeling of lactic acid building up in your body. For normal, healthy individuals, that is recovered from easily. When too much lactic acid builds up faster than we can get rid of it, we have lactic acidosis. Hyperlactemia is when lactate levels are greater than 2.0. I will be focusing on lactic acidosis, which is considered lactic acid levels of greater than 4.0. If you are a patient with metabolic acidosis, chances are it is caused by lactic acidosis. That is the most common cause. If the body is low on oxygen, one way it will produce energy is from anaerobic metabolism. Glucose is turned into pyruvate, which in turn is turned into lactate thanks to the enzyme lactate dehydrogenase. This action also gives off NADH+, which the body uses for glycolysis. The lactate is taken to the liver and is used for glyconeogenesis. It is converted to pyruvate and then glucose and goes back to the muscles. There are three main causes that lead to lactic acidosis. One being an increased production level of pyruvate. This can be caused by, for example, by glycogen storage disease type 1, or otherwise known as von Gerke disease. Since glyconeogenesis is impaired, that leads to excess pyruvate, which is turned into lactic acid. Another cause is impaired mitochondrial utilization of pyruvate and NADH accumulation. Hypovolemia is when your body has a decreased level of blood circulating, so your body doesn't have enough oxygen being delivered. This causes the anaerobic pathway to kick in and leads to an increase in lactic acid. You could also have enough blood volume but is unable to get where it needs to go. This can happen, an example, in sepsis and cardiac failure. Liver disease or liver damage can also cause lactic acidosis. The liver is where lactate is broken down and processed. Alcohol use can also play a role in increased lactic acid levels as well. Ethanol lowers the NAD plus and NADH ratio, which in turn turns into more pyruvate into lactic acid. High lactic levels can be dangerous among patients. Patients with mildly elevated and intermediate levels along with sepsis have higher rates of hospital 30-day mortality. Symptoms can include short of breath, rapid breathing, stomach pain, confusion, nausea, vomiting, cool skin. Because lactic acidosis is a common cause of metabolic acidosis, you'll typically see a pH of less than 7.35 and an anion gap of greater than 15 is typically seen. It is important to find the underlying cause and treat that immediately. Saline fluids and broad-spectrum antibiotics are also given as soon as possible, along with a breathing treatment and oxygen as necessary. Because glycolysis will continue after blood is drawn, the RBCs and white blood cells will continue to produce lactic acid. So a big problem is falsely increased results. Putting the sample on ice and getting this sample spun down immediately is extremely important in giving accurate results. Being on ice helps slow lactate production. And that is all.